Hey guys, so this is Dr. Islam. I'm going to be talking about NAD and its benefits on helping with withdrawals, or actually from an anti-aging perspective for patients. NAD is a component within our bodies, and actually it helps with DNA repair as well as elongating the telomeres, which is when the DNA gets replicated, a little bit gets sheds every time, but it keeps it elongated. And it also works on the mitochondria, which is these little areas that produce the energy section of our cells. Okay, now. They've actually shown studies. So on a before we get into it, actually they've shown studies with NAD, and this is from the anti-aging community, where they've actually taken like rats and they've started outperforming young rats in running. So it's like the comparison was something like a 90-year-old, person outrunning a 20-year-old person like in a marathon. Okay, just to kind of give you a name. But let's go over here, and this article will be on my website, so you can kind of see it as well. So let's kind of take a look here, and so you can kind of see. So we kind of went over that. So let's go over some patients here. So this patient here was on Suboxone for a few months and cocaine. Also 20 years on Adderall and Ritalin. Very depressed. Lack of motivation. And then after the nuclear imaging, you can kind of see this is her before, and then let's take a look at her after here. So you can see a vast improvement in the the after photo here. Okay. A lot of her bone pain, restless leg, gone within 7 days. A lot of the withdrawal symptoms resolved. Okay. Same. This was a patient with cocaine. Let's look at the imaging here. Okay, you can kind of see before, see after. So. Within 4 days, his cocaine cravings has resolved. Okay, so let's take a look here. Let's kind of go down. So typically with patients, I typically recommend doing about 2,000 to up to 5,000 milligrams within that month's time frame, especially if you're trying to come off of something, whether it's Suboxone, whether you're trying to get on Suboxone and try to prevent any withdrawals. It will help a lot of the withdrawal symptoms or whatnot. Even from an anti-aging perspective, if you're doing from an anti-aging perspective, I typically tell patients, doing like 1,000 milligrams to 2,000 milligrams a month is more than enough. But it's a very great substance to help patients, from an anti-aging perspective, as well as just keeping up general longevity and health. As far as, you can kind of see the recommendation here. I don't typically do it like this. From a cost perspective, you can do it by IVs, but I like patients inject a small amount daily, because when you're doing an IV with NAD, it's a very long infusion. So, and you're just in the office for a very long time, and versus you can do a small amount daily. Yes, you will feel a little bit of flush, typically on the side that you inject, but it's not too bad. Within like a half an hour to an hour, that flushing feeling kind of goes away. But especially if you're, if you've been, having withdrawals or whatnot, that's nothing. So I tell patients this is a very good thing to add on, especially if you're having any sort of withdrawals. And I hope you guys take a look at it, look at the article, and reach out to our office if you have any questions and whatnot. All right, take care, Dr. Z.